Here's something almost nobody over 70 knows. The most dangerous minute of your day is not the minute you spend driving. It is not the minute you spend climbing the stairs. It is the 2 minutes you spend drying your skin after your shower, 41%. That is how many seniors land in the emergency department with a skin problem that started as something they thought was just dry skin. Remember that number. We are going to come back to it. Most of my patients believe the worst thing for their skin is what they put on it, a harsh soap, a cheap lotion, something they ate. In reality, the worst thing is the thing they do without thinking, the rough rub of a bath towel across an aging body twice a day for decades. Over time, that single habit is doing more silent damage than half the supplements in the back of a magazine. Stay with me. I am going to show you why. Let's talk about what we are really fighting here. We are not talking about flaky ankles in winter. We are not talking about a little itching you can ignore. We are talking about whether you carry your own groceries next winter, whether you walk your granddaughter down the aisle without a wound on your hands, whether a small crack behind your knee becomes a 5-day hospital stay, whether you keep your independence or quietly start losing it, one infection at a time. That is the scale of this conversation. My name is Dr. David Reynolds. I have practiced dermatology and senior internal medicine for 19 years. I have treated more than 11,000 patients over the age of 65. I have published peer-reviewed work in the Journal of the American Geriatric Society, and I lecture twice a year at the Mayo Clinic on aging skin. I am not here to sell you a supplement or scare you into buying a course. The only thing I want to sell you tonight is a habit that costs you nothing but 2 minutes. You do not need a new product. You need a new habit. And the 7 I am about to walk you through are the most neglected ones in older adult skincare. Number 7 is the one I will save for last. It is the one that surprises even doctors. It involves a piece of furniture you probably own and the way you let it touch your body every night. If you only listen to one tip tonight, listen to that one. Before we get into the science, drop a comment below and tell me your age, just the number, nothing else. I read every single comment. Many of my longtime viewers leave their age, their city, and one thing they want to fix about their skin right now. I read every one of them. They guide the videos I make next. I want to give you a quick map of how your skin works after 70. 3 ideas, 3 small ideas, and we are going to come back to these throughout the rest of this video. So lend me your ears for 90 seconds. Number 1, the brick wall. Think of your outer skin like a brick wall. The bricks are your skin cells. The mortar between the bricks is made of oils and fats that hold water in and keep germs out. After 70, the mortar between the bricks gets thinner every year. So the wall leaks. Water leaks out. Germs leak in. Number 2, the river delivery system. Think of your bloodstream like a river delivery system. It carries nutrients, water, and healing cells to every corner of your body, but it takes longer to deliver them to skin that is cracked, raw, or inflamed. So when you injure your skin, you heal slower than you used to. Number 3, the invisible cracks. Tiny cracks in your skin are not accidents. They are an open invitation to bacteria. 1 crack behind the knee, 1 split between the toes, 1 tear on the forearm. These are doors into your body. Bacteria walk across your towel, off your fingers, from your pets, and into those doors. That is the start of cellulitis, an infection that brings more than 700,000 seniors to the emergency department each year. Keep those 3 ideas, the brick wall, the river, the invisible cracks, and now let us go through the 7 dangerous drying mistakes. Number 7, the rough rub. The most common mistake, and the one almost no one questions, is how you move the towel. Here is what it does inside you. When your skin is warm and wet, the brick wall I just described is at its softest. The mortar is loosened. Tiny cracks are already forming, even if you cannot see them. When you drag a towel across the skin with force, back and forth, up and down, you are dragging it across half-open cracks. You are scraping mortar off the wall. You are widening the doors. The The British Journal of Dermatology published a study by Dr. David Vogeli of the University of Manchester on exactly this. In a controlled trial of 42 older adults, repeated rough towel friction after bathing measurably reduced skin barrier function within 7 days, compared with gentle patting. What to do instead? Pat. Do not rub. Press the towel against your skin and lift. Let it absorb. Take 4 extra minutes. Soft cotton only. No terry cloth robes that drag and pull across thin skin. A patient I will tell you about. Her name I will call Margaret. Margaret was 73, from Tulsa. She came to me with cracked, bleeding forearms and said, "Doctor, I drink water by the gallon. I moisturize 3 times a day. Why am I so dry?" I asked her how she dried off. She said, "Like everybody does. I rub." We changed one habit, patting only. 41% faster healing of her forearm splits over 6 weeks. Synergy tip, pair this with item number 3, the 3-minute rule, on the list. So what should you do instead? Stop being in a hurry. Pat, press, lift. Every square inch. That is not a small number, 41% faster healing, just from changing how the towel touches the skin. Number 6, skipping between the toes. Here is the part that should concern you most. When you dry your body, focus on what you can see. Skip what you cannot. The space between your toes is the part you cannot see, so it is the part most people breathe on once and call it dry. Here is what it does inside you. A warm, dark, slightly damp space between your toes is the perfect home for fungus. Fungus grows, the skin breaks down, the cracks widen. Bacteria arrive second. Cellulitis starts on the foot more often than any other part of the senior body. A review of more than 6,000 cases in the American Family Physician Journal found that ordinary athlete's foot was the visible trigger behind roughly 23% of foot cellulitis cases in older adults. 23% of these terrible infections, and they started with skin that never got fully dried. What to do instead? Use the corner of a thin towel, press it between each toe, then lift and replace. Pat the web spaces between each finger too, especially if you garden or you have diabetes. 2 minutes of focused work. You will skip withering, peeling, deep cracks. Let me tell you about someone I will call Walter. Walter was 78, from Phoenix, a retired postman. He came to me because my left foot just wouldn't stop swelling. Cellulitis. 3 days in the hospital. 2 courses of antibiotics. We got him out. He asked me what to do differently. I said, "Walter, the cure was not in the pill bottle. The cure is in this corner of a towel." He nodded. He never had cellulitis again in the 4 years I saw him after. So, what should you do instead? 2 minutes. Press between every toe. Press between every finger, especially if your immune system is on the quieter side. Number 5. The hot water habit. We have all done this. The shower is cold in the morning. You turn the dial up. You soak. You feel better. Here is what it does inside you. Hot water strips the thin layer of natural oils I told you about, the mortar. It also pushes blood to the surface of your skin, then pulls it back when you step out. Older vessels do not handle that swing as gracefully as young ones. The result is that shower brings a flush, then a deep dryness that is harder to repair than what cool water leaves behind. A study of 900 community-dwelling seniors published in Dermatology Nursing found that those who reported hot water bathing had a 58% higher rate of severe winter itching than those who used lukewarm water. What to do instead? Turn the dial down. Aim for a temperature that feels warm, not hot. If your skin turns pink after a shower of 2 minutes or more, the water is too hot. Cool it by 1 setting. Pat the skin, we already covered that. A patient I will call Anna, 71, from Boise. Anna loved her showers. 25 minutes, near boiling water. She came in with red, raw shins and asked, "Why does my skin feel like paper?" "Anna," I said, "your skin is not made of paper. It is just empty of its oils. Turn the dial down. Take 8 minutes instead of 25. She did. Her shins were smooth again in 4 weeks. Same body, same shower. One number changed. Synergy tip: pair this with the 3-minute rule. Cool water preserves the oils and immediate moisturizer locks in what is left. That is not a small number. 58% reduction in that awful winter itch. Number 4, air drying without sealing. A lot of seniors I meet are proud of this one. Doctor, I let myself air dry. I do not put anything on. I let my skin breathe. I appreciate the instinct. The instinct is not the worst one in the world, but the execution is. Here is what it does inside you. When your skin is wet, water is sitting in the upper layers. As that water evaporates, it pulls moisture out with it. It is a one-way valve. Your skin ends up drier than it was before you stepped into the shower in the first place. There is a clinical trial published by a team at the University of California, Davis, in the Journal of Drugs in Dermatology. 63 older adults were followed for 12 weeks. Those who patted dry and applied a moisturizer within 3 minutes had hydration scores 36% higher at the end of the study than those who air-dried and applied moisturizer 10 minutes later. What to do instead? Pat dry. Then immediately, within 3 minutes, the same window, the Mayo Clinic dermatologist Dr. Dawn Davis calls the magic 3-minute window. Apply your moisturizer. Do not let the water evaporate. Trap it in. A patient I will call Frank, 69, from Columbus. Frank came in with heels cracked so deep he could not put weight on them in the morning. I moisturize every night, Doc. When, Frank? Before bed. What time? 11. When do you shower? 7 in the morning. Frank had been drying his skin for 16 hours before adding anything back. We switched him to the 3-minute window. The cracks healed inside of 3 weeks. So what should you do instead? 3 minutes. Set a phone timer if you have to. That is not a small number. 36% more hydration from the same moisturizer just by changing when. Number 3, forgetting the skin folds. Take a moment after you read this one. Where do you dry? You dry your arms, your legs, your chest, your back. Do you dry the fold under your breast if you are a woman? Do you dry the fold under the belly if you are a man with a little extra weight? The groin, behind the ears, the groin, the belly fold, between the buttocks. Here is what it does inside you. These folds trap moisture. Friction from clothing rubs constantly. The skin gets raw. Once raw, fungus and bacteria arrive together, what we call intertrigo. In the right conditions, what started as intertrigo becomes cellulitis. A review published by the American Academy of Family Physicians found that seniors with skin fold moisture and friction had a 45% higher rate of secondary infection than those who kept those folds dry. What to do instead? After your shower, use a thin towel corner or a soft, dry cotton cloth to press deep into every fold. Then either let the fold air out for 10 minutes before dressing or dust a thin layer of plain zinc oxide paste into the fold. Let me tell you about someone I will call Helen. Helen was 82, from Hartford. She came in with what looked like diaper rash on her belly, bright red, raw, an odor she was embarrassed to mention. I never told my daughter. I thought it was just old age. Helen, I told her, this is not old age. This is undried skin. We cleaned it, dried it, dusted it, and checked it again every week. It cleared in 10 days. Helen cried in my office and said, I almost never told anybody. I said, Helen, that is what we are here for. Synergy tip. Pair this with number 4, the 3-minute rule. If you have folds, a thin layer of barrier cream inside the fold and a thin layer of moisturizer around the fold does what a single product cannot do alone. So what should you do instead? Press, lift, air dry for 10 minutes if you can, then dress. That is not a small number. 45% reduction in skin fold infections just from careful drying. Number 2, body scrubbers and washcloths in the shower. This is the one that surprised me when I first read the data, and it still surprises my patients when I tell them. Here is what it does inside you. Loofahs, brushes, exfoliating gloves, even a standard washcloth, these all abrade the skin. Each stroke is a tiny scrub on the brick wall. For young skin, this is fine. The brick wall heals overnight. For older skin, the brick wall does not fully heal. You are wearing it down, shower after shower. A Japanese clinical team published in the journal Skin Research and Technology a study of older adults over 8 weeks. Those who used soft, disposable, low-pressure cloths instead of standard washcloths had 61% fewer reports of skin barrier damage after bathing. 61%. That is not a small number. What to do instead? Use your hands. Soap in your palms, applied gently with the flat of your fingers, no rubbing. If you must have cloth, use a single-use, soft, disposable cloth and discard it. No long sponges, no brushes, no buffing. A patient I will call Robert, 75, from San Antonio. Robert liked his back scrub. He told me, "Doc, I feel clean when I scrub." Robert also told me he bled into his shirt every morning. I asked to see. Tiny scratches across his back. Skin barrier paper thin. We pulled the scrubber. We used only hands. He bled into his shirt for the last time in his life the next week. So, what should you do instead? Hands, flat of the fingers, or one soft, disposable cloth, used once. Number 1, skipping moisturizer after towel drying at all. This is number 1 because it is the most common, the most damaging, and the easiest to fix. Here is what it does inside you. After a shower or bath, the mortar between your bricks, the oils, has been stripped. If you do not replace them, your body goes looking for water from deeper in your skin. Deeper in your skin is the dermis. The dermis holds your nerves. The result is the worst kind of itch, the deep, restless, can't sleep kind of itch. A 2-year observational study conducted at the University of Manchester, involving 1,200 older adults, found that those who did not apply a moisturizer within 30 minutes of bathing were 2.4 times more likely to develop chronic winter itch than those who did. 2.4 times. What to do instead? Use the 3-minute window. Pick a moisturizer with 3 plain ingredients: petrolatum, glycerin, or ceramides. No fragrance, no alcohol, no active botanicals you cannot pronounce. After your shower, pat dry, then apply. Use enough. A teaspoon for each arm, 2 for each leg, a little more for the back. A patient I will call Mary, 80, from Indianapolis. Mary had not slept a full night in 7 years because her legs itched so badly. "Mary," I said, "apply this cream within 3 minutes of your shower every single day for 30 days. She did. Day 19, she came back and said, "Doctor, I slept last night." She cried in my office, and I will admit, that is the kind of visit that keeps me in this work. My first reaction wasn't fear, it was frustration. 7 years of bad sleep because of one habit. Synergy tip, pair this with number 7 on the list, the rough rub. Pat, do not rub. Then moisturize within 3 minutes. The two together are not additive, they are multiplicative. That is not a small number, 2.4 times the risk of itch, just from skipping moisturizer after drying. We are 7 habits deep now. If this video has helped you see your shower in a new way, please consider subscribing. Every week I post videos that take the truth your 15-minute doctor's appointment does not have time to cover, and we go through it together. If you know a spouse, a sibling, a parent, a friend who lives alone, please share this with them. Most seniors who end up in the hospital from these infections had somebody who might have warned them if that somebody had known. You can be that somebody. Let's bring it all together. Number 7 was the rough rub. Scrubbing with a towel strips oils, opens cracks, and slows healing by 41%. Pat dry instead. Number 6 was skipping between the toes. Invisible cracks invite cellulitis. 23% of senior foot cellulitis starts here. Press a towel corner between each toe. Number 5 was hot water. stripping oils and stressing vessels. Lukewarm water cuts winter itch by 58%. Number 4 was air drying without sealing. Water evaporates and takes moisture with it. Moisturize within 3 minutes, 36% more hydration. Number 3 was forgetting the skin folds. Folds trap moisture and breed infection. 45% fewer infections just by drying, airing, and dusting. Number 2 was scrubbers and washcloths. Brushes thin older skin. 61% less barrier damage with hands alone. Number 1 was skipping moisturizer after drying. 2.4 times the itch risk. Same cream, right window, every day. 7 habits, 7 mechanisms. 1 brick wall, 1 river, 1 set of invisible cracks. Most of this costs nothing. All of it takes less time than brushing your teeth. 2 steps tonight, 5 this week. Tonight, read the label of your current moisturizer. If you cannot pronounce 3 of the words, swap it for a plain petrolatum, glycerin, or ceramide product before the weekend. Tonight, set a 3-minute timer on your phone. Use it after your next shower. Move quickly. This week, replace 1 bath towel with 2 thinner, softer towels to make padding easier. This week, practice pressing a towel corner between each toe. This week, audit your shower temperature. Aim for warm, not hot. This week, buy a soft, disposable cleansing cloth or just use your hands. This week, if you have skin folds, set a 10-minute air-out window after bathing and a small tube of barrier cream. Let me speak to you plainly for a moment. When I think about why I do this work, I am not thinking about the science. I am thinking about a man in his 70s, sitting in his kitchen, holding his own grandson's hand, never having to ask someone to help him put on a sock. I am thinking about a woman who can sit through her granddaughter's wedding without pain in her heels. I am thinking about a couple at dinner, laughing about a small joke, neither one of them conscious of their skin. I am thinking about independence, dignity, and the small, quiet victories of an ordinary Tuesday. These are the things we are protecting when we change how we dry our skin. It is never too late. The brick wall still heals, the river still flows, the cracks still close. Your skin is listening to what you do today. Tomorrow, it will reflect it. If this changed the way you think about your shower, subscribe and ring the bell. I post every Tuesday. I read every single comment. Drop me your age, your city, and one thing you are going to change about how you dry your skin after today. I will be reading them all week.